Red light therapy looks like sci-fi, but some of it is legit. The problem is buying the wrong device for the wrong goal. Because the device is not the protocol. A glowing panel on the wall does not automatically mean collagen, pain relief, better sleep, fat loss, testosterone, and mitochondrial wizardry are all arriving by Friday. Red light therapy is not fake. It is just wildly overmarketed. The better question is not does red light work? The better question is, for what goal, at what wavelength, at what dose, from what distance, for how many weeks? That is where the hype starts to fall apart. Most people buy a panel, stand somewhere nearby, guess the time, close their eyes, hope for the best, and call it biohacking. But photobiomodulation, the science term for red and near-infrared light therapy, is dose-based. Wavelength matters, distance matters, time matters, the tissue target matters. Red light therapy is not automatically good because it glows red. A toaster glows red too. The difference is the protocol. So today we are building the longevity compass buyer framework: wavelength, dose, distance, time, evidence buckets, safety, and what claims to ignore. First, what is red light therapy? Photobiomodulation usually uses non-ionizing red or near-infrared light from LEDs or lasers. It is not UV light. It does not tan the skin, and it is not the same as infrared sauna. Sauna is primarily a heat stress. Red light therapy is supposed to be a mostly non-thermal light signal. The common therapeutic window is roughly 600 to 1100 nanometers. Red light is visible, often around 630, 633, or 660 nanometers. It is commonly discussed for skin, surface tissue, redness, texture, and cosmetic goals. Near-infrared light is usually around 810, 830, or 850 nanometers. It is mostly invisible or only dimly visible, and it is used more often for deeper targets like joints, muscles, tendons, and some experimental brain or sleep applications. Simple version: red light is more of a skin and surface tool. Near-infrared is more of a deeper tissue tool. But neither one matters if the dose is wrong. Now let's decode dose. Wavelength is the color or type of light. Irradiance is how much power reaches the skin surface, usually measured in milliwatts per square centimeter. Fluence, or dose, is the total energy delivered over time, measured in joules per square centimeter. The basic math is simple. Dose equals irradiance times seconds. If a panel delivers 50 milliwatts per square centimeter, that is 0.05 watts per square centimeter. If we use it for 10 minutes, that is 600 seconds. So 0.05 times 600 equals 30 joules per square centimeter at the skin surface. But that does not mean 30 joules reaches the knee joint, tendon, or muscle. Skin reflection, tissue absorption, hair, skin tone, distance, angle, and clothing all change the real dose. This is why the marketing gets messy. A company may advertise a huge irradiance number measured right on the LEDs, but you are not supposed to press your face into the panel like you were interrogating a vending machine. Distance changes the dose. Time changes the dose. More is not always better. Photobiomodulation has a biphasic dose response. That means too little may do nothing, but too much may also be less effective. With red light therapy, more is not always biohacking. Sometimes more is just overcooking the signal. Now let's talk evidence. Bucket 1. Skin. Skin is one of the more reasonable consumer uses. The best claim is not age reversal. The better claim is gradual improvement in texture, roughness, redness, fine lines, and collagen-related appearance over weeks to months. This is not a face transplant from the future. It is more like gradual polish. For skin, the practical protocol is usually red light around 630 to 660 nanometers, 5 to 10 minutes, 3 to 5 days per week, at the manufacturer's recommended distance. Track photos every 2 weeks under the same lighting. And please keep the basics. Sunscreen, retinoids or retinol when tolerated, sleep, protein, and not treating your face like it owes you money still matter. Bucket 2. Pain, joints, and tendons. This is one of the more credible areas, especially as an adjunct. Red and near-infrared light may help pain or function in some conditions, but the effect depends heavily on the condition, device, dose, and treatment area. For pain, think support tool, not miracle cure. If knee pain improves enough that we can walk more, strengthen better, and stick to rehab, that is valuable. But a red light panel does not replace strength training, mobility, weight management, sleep, physical therapy, or medical evaluation of serious pain. A smart starting point for joint or tendon discomfort is a red and near-infrared combo, or mostly near-infrared around 810 to 850 nanometers. Treat the specific area for about 10 minutes, 3 to 5 days per week, then reassess after 4 to 8 weeks. Bucket 3. Wounds and medical conditions. This is scientifically interesting, but not a DIY playground. Photobiomodulation has credibility in certain clinical settings, including wound healing and cancer treatment-related oral mucositis. But diabetic wounds, infected tissue, burns, surgical wounds, and suspicious skin lesions need medical care. Do not shine a panel on a serious wound and delay evaluation. The red light should not become a glowing excuse to avoid the doctor. Bucket 4. Sleep. This is where we need to be careful. Red light may be sleep-friendly. That does not mean every red light device is a sleep treatment. There are small studies suggesting red or near-infrared phototherapy may improve relaxation, perceived sleep quality, or daytime function in certain protocols. That is interesting, but it is early evidence. For sleep, red light therapy belongs in the promising but not primary bucket. The stronger sleep tools are still consistent wake time, morning outdoor light, dim evenings, caffeine cutoff, cool bedroom, stress off ramp, and screening for sleep apnea when the signs fit. If using red light before bed, avoid bright light directly into the eyes, avoid sessions that make you feel alert, and treat it as relaxation support, not insomnia medicine. Bucket 5. Muscle recovery and fitness. This is mixed and dose sensitive. Some protocols may help soreness or performance outcomes. Others do little. It depends on timing, device, dose, muscle group, and training type. Do not use red light as a replacement for protein, progressive training, hydration, electrolytes, deload weeks, or sleep. If those are missing, the panel is just expensive mood lighting for a poorly recovered body. Now here is the buyer framework. Step 1. Choose the goal first. For skin, prioritize red wavelengths like 630 to 660 nanometers. For deeper joints, muscles, or tendons, prioritize near-infrared like 810 to 850 nanometers. For sleep, treat it as experimental relaxation support. Step 2. Demand wavelength transparency. The device should list actual wavelengths, not just therapeutic red light. A common consumer combination is 660 and 850 nanometers, but the goal still matters. Step 3. Demand irradiance at a real distance. The company should tell us the measured irradiance at the recommended treatment distance, not just a giant number taken right against the LEDs. Step 4. Match the treatment area. A tiny wand may be fine for a spot. A mask may fit face skin. A panel is better for larger body areas. A belt or wrap may help target joints. Bigger is not always better. Matched is better. Step 5. Do not confuse heat with benefit. Photobiomodulation is supposed to be mostly non-thermal. Warmth can happen, but burning heat is not the goal. If it feels like punishment, something is wrong. Step 6. Check safety instructions. A responsible company should discuss eye safety, treatment distance, treatment time, contraindications, and photobiological safety. Do not stare directly into powerful LEDs, especially near-infrared LEDs that are hard to see but can still enter the eye. Step 7. Check the return policy. Results are gradual and individual. A device with huge claims and no realistic return policy is a red flag, literally and financially. Now the claims to ignore. Be skeptical of melts fat, boosts testosterone, reverses aging, detoxes cells, heals anything, works at any distance, activates mitochondria instantly, and medical grade because it costs more than your first car. FDA cleared is not the same as FDA approved for every wellness claim. Cleared for one intended use does not mean proven for everything on the marketing page. Final takeaway. The glow is not the treatment. The protocol is the treatment. For skin, think gradual improvement. For pain, think adjunct support. For wounds, think clinician guided. For sleep, think early signal. For wild miracle claims, think marketing department. If this helped you separate real red light therapy from red light theater, tap like, subscribe to Longevity Compass, and check the description for our Amazon KDP book and helpful tools to compare red light devices safely. Because the goal is not to buy the brightest panel. The goal is to use the right wavelength, at the right dose, for the right reason.